Hello, everyone. Welcome to Mantra Talks with Industry Experts, an initiative by Mantra Labs, an InsurTech 100 firm building products and solutions for the changing world. Undoubtedly, the outbreak of pandemic COVID-19 has affected the global economy. The pandemic is disrupting global supply chains and international trade. Many industries have been hit due to this. But the biggest impact of COVID-19 has been on the healthcare sector. Indeed, it has been a challenge for hospitals to deal with this unprecedented pandemic at such a large scale. So, in order to understand the impact of this crisis in the healthcare sector, we thought about interviewing some various industry experts to get the sense of current situation. In today's session, we will discuss how technology can help combat current challenges faced by healthcare and possible mitigation strategies to help this industry. So, in this special edition of Mantra Talks, we have our very own CEO of Mantra Labs, Mr. Parag Sharma. Parag started Mantra Labs to solve insurer-specific challenges through real-world problem-solving using AI. He's a product enthusiast and tinkerer at heart who has helped create innovative new products in the field of artificial intelligence, such as Visa, a conversational mental health therapy bot. He also holds over 10 years of experience working in the services line and has been instrumental to launching several startups in the internet and mobile space. His rich domain expertise and innovative leadership has helped Mantra climb to the top 100 innovative insurtechs in the world, selected by FinTech Global. Today, along with his co-founders Mikhail and Sambhav, he is leading a 150 plus strong team of engineers with serious capabilities in insurance, AI, and CX. A very warm welcome, Parag.
Thank you, Divya.
All right, so let's dive right into it. Considering the COVID situation, according to you, how has COVID-19 impacted the IT and service operations among healthcare organizations?
Since the onset of COVID, healthcare institutions have been deeply impacted because of, at one hand, the institutions are facing severe crunch in terms of manpower. IT support systems, which usually used to be manned and managed by a large team of IT professionals, is no longer available with the same strength. So there are severe pressures and that IT institutions or healthcare institutions are facing from many of these perspectives. There is shortage of resources, there is shortage of IT personnels, not just from a critical care perspective, but even for the support perspective, there is a shortage of people all around because people are not really comfortable coming out of the safety confines of their homes and being in an institutional environment where they think that they may be exposed to some infections or other things that can happen.
True. I think that the scare of getting infected is going to be there until and unless we actually have a concrete solution like a vaccine or a cure for it.
Yeah.
So we have just dealt with the first pandemic wave, and so in some countries it's still going on, like ours. But the second one won't be far. So what do you think, what can hospitals do to ensure the continuity of their customer-facing operations in the wake of a second pandemic wave?
There's a lot of things that hospitals can do to manage themselves in this hour of crisis. And of course, being more digital than what they already are is definitely one step forward for all of them. An ability to bring your IT systems to a cloud so that your personnel can manage it remotely. An ability to allow your patients to book appointments with your doctors or even ask patient-specific inquiries about various services in the hospitals, not necessarily through the conventional ways of calling up the reception and getting this information, but a more less touch way of getting this information is something that hospitals can provide to their patients to give them the same level of service without really asking them to come all the way to the hospital to access such services. It could also be extended to extending telehealth services to a large number of your patients. And telehealth is something that has been proved to be a real useful case, especially when you have such a large number of patients and there's a huge asymmetry between the number of patients who are seeking medical care and the number of providers who are available in our country. So given that such a huge disparity, I think it'll be very useful in case if healthcare institutions can deploy telehealth solutions so that medical facilities and care can be extended to large sections of our society which have so far been outside the benefits of healthcare.
Yes, I think in the wake of this pandemic, telehealth, telemedicine, these are the things which healthcare has been trying to implement over so many years. Yes. COVID has actually accelerated it.
Yes, that's true.
And it is soon might be a new normal.
Yeah, absolutely. I mean, this is definitely going to be a new normal, given the fact that patients are not coming out. It is the onus of the hospitals to take these services to the patient home. In case if a patient wants to, let's say, book an appointment with a doctor, or he wants to access some diagnostic services or pathological services, there's absolutely no need for a patient to come out of their home. If the hospitals can provide him the facility and care to come all the way to his home. So that will definitely be a much enhanced experience that patients would expect from their healthcare providers to be in a position to give them.
Completely agree with that. So talking about the new normal, is the consumer behavior defined by the new normal going to change the way we access healthcare from this point on?
Yes, I mean, of course, people expect a completely different way of accessing this care, and hospitals should gear up to be able to rise to this occasion of and the opportunities that has been created by the ongoing pandemic. So the hospitals should be able to rise up to this occasion, adopt a completely different set of process and approach that they have not been used to so far. They always felt that medical care cannot be really provided remotely, but now that it is happening and people are seeing that, yes, patients are indeed appreciating provision of healthcare even remotely. So, of course, I mean, hospitals and healthcare institutions do have an evidence to be convinced with the fact that, yes, this telehealth and a remote care would probably be more successful in time to come.
Yes, I think now that we have seen that people also have experienced it firsthand and they are now more comfortable for it, there will be an increase in demand for this home care, remote monitoring and remote diagnostics and remote healthcare.
Right.
So again, talking from a hospital's perspective, what are the operational challenges as far as digital capabilities go that hospitals are facing currently? And what steps must they take to bridge these gaps?
Yeah, operation challenges are not just digital challenges. It's very much related to the functioning of hospitals themselves, which are not really related to technology. But a lot of these challenges, in case if we are using technology, can perhaps be addressed. Like, for example, your electronic health records, which hospitals manage within the premises of their hospitals, can very well be taken over to the cloud, so that your personnel will be able to manage your entire electronic health record systems, your EHI systems, from the cloud itself. So they don't really need to come all the way to the institution, to the hospital. Secondly, if you deploy telehealth and telemedicine solutions, irrespective of where your patients are and wherever your doctors are, they can still access that care which is provided by the hospitals. You would probably be able to even extend your diagnostic services to the patient hospitals by giving them an application through which they can seamlessly book an appointment, get their queries answered, appointment for their diagnostic services, for pathological services. So giving a seamless interface either through a bot or through mobile applications, which will go a long way in providing the desired services to the customers.
Certainly. Chatbots and applications are going to, these new age technologies will definitely play a very crucial role in the healthcare in coming days. So, according to you, what role does chatbots powered by artificial intelligence have in the healthcare customer experience landscape?
There are a lot of things that bots can do easily and in a very simplistic way. If a patient has to book an appointment with a doctor, instead of going through complex web applications, web interfaces, multiple, what if I could just write, I want an appointment with Dr. Suman at 4 o'clock tomorrow, and a bot can figure out in case if the time slot is available for Dr. Suman. And in case if the time slot is available, the bot confirms, yes, the doctor is available. Patient says, yes, very well, book an appointment for me, and then followed by a payment process in case if the payment has to be made upfront, or a payment can be also made later. So bot makes, of course, things very simple and easy for any patient to access this service. You don't really need to install any mobile applications. If you have a web application and you have a bot over there, you just interact with this bot and you get your things done. Not just this, you could extend your bots to provide a lot of e-consultation and doctors consultation services over audio and video platforms. So there's a lot that can be done beyond just plain and simple answering patient queries or allowing them to book appointments for various services.
Certainly, chatbots, I believe that in coming years are going to be a hygiene practice for every organization.
Correct. And it doesn't stop there. I mean, you can, of course, extend and use bot-like services for not just direct patient care, but also for your business process efficiency, for your HR needs, for your finance needs, for various interactions within the organization itself, so that they can provide a better service to their customers and also improve their own internal business processes. So I think these are the tools which help hospitals to do much better in terms of the business process efficiency itself.
Exactly. So expanding a little bit on the role of chatbots, could you tell us some other possible bot use cases for delivering better customer experiences to digital health users?
Yes, I mean, as I mentioned, booking appointments, being able to answer questions are straightforward use cases for bots. But beyond that, you could also be able to use these bots for your video and audio consultations with doctors. You could possibly use it for internal usage. And then, of course, I mean, it could also be extended for a patient to inquire about the insurance of the patient and all the interactions that happen between an insurance company and a hospital can also be provided to the patient for the benefit of the patient over this bot interface. Going further, I mean, in case if you look at other aspects which are beyond the bot, integrating your interactions with the hospitals, or the interactions between the hospitals and the insurance companies should be completely reimagined and reorganized, because there's a lot of process inefficiency that is in place for all the interactions that happen between the insurers and the hospitals. And there is a very strong need for an establishment of something like a health information exchange that both hospitals and insurance companies could possibly use for exchanging this information, which will bring a lot of benefits for not just the healthcare institutions, but for the for the insurance institutions as well. And of course, the ultimate beneficiary of the improvements in the process here would be the patients. So patients definitely are going to be benefited by any improvement by bringing in digital technologies.
Exactly, because this is, I think, an era or a situation wherein patient experience will take precedence and over most of the things.
Yeah, absolutely.
Parag, we have actually come towards the end of the interview. In the last segment, would you like to add? Would you like to give some tips or something that you would like to add in technology in the healthcare space?
Yeah, I mean, I think technology is very well poised for with an opportunity to play a big role in improving the customer experience, in bringing about better healthcare to a large number of people. India, it's such a large country, and there is huge asymmetry between the healthcare providers and the number of people who are seeking these services. So without technology, I do not think there is any way hospitals or healthcare institutions will ever be able to scale to the level that they can provide a meaningful service for such a large number of people. So technology is the only way out here. And unless hospitals and institutions adopt these methods, they will not really be able to meet the bar which is expected. So setting up an information exchange, making the process as seamless as it can be, removing all possible inefficiencies from the supply chain by adopting technology. I think these would be the best things for hospitals to invest upon for the future, because the future growth for the hospitals will come from the digital technologies, because patients will definitely move to more and more digital technologies, and it's only for the hospitals to catch up with the patients, because there's no stopping the patients. Patients and people will definitely adopt these modern technologies much faster than our enterprises can, and it's for the enterprises to catch up.
Exactly. I mean, that's very true. More and more people are going to go digital. So it's just a matter of time that enterprises and enterprises across all the sectors have to catch up with with the rapid digitization. With this, thank you so much, Parag, for joining us in this interview. It was wonderful interacting with you. And thank you for all the insights, that wonderful insights.
Thank you so much. Thank you so much, Divya, for having me here. Thank you.
Thank you.